we are happy that we are in position to help others. I just want to see people happy.
I think it's wonderful, unique, and appropriate that my mother is being honored tonight, and I'm thrilled. She deserves it in every way. She was always a backbone for my father. She was a backbone for our family growing up, and she certainly has been thrilled and extremely supportive and satisfied with the involvement in the Children's Hospital, and continues to be a huge supporter.
So as a child life specialist, my role is to help the kids to understand why they're here, but in a child-friendly manner, because the kids don't understand what the doctors are coming in and telling their parents. So we do a lot of medical play and play with dolls so they understand and they can ask in the language that they know, which is play. So if it wasn't for generous donors like the Hovnanians, we would have never had any child life specialists in the hospital, and now we have 3 full-time because of them.
If you want to build a house, you need a building blocks. And if you want to get building blocks, you need money. And the money that was able to be given by the foundation, which they had, they got from the generosity of the donors, has helped a lot. You can look around and see the beauty of this place. You don't want to be sick and have a very bleak environment. You want a bright environment. That in itself psychologically helps the patient, and you can look around and see what you have.
The involvement began before a tragedy with my late son, and that changed my father's direction of giving with Riverview, and decided to channel his efforts toward an emergency room and emergency center at Riverview, named after my late son. After that initial giving, he stayed in touch with the hospital and wanted to do more, and asked John Lloyd at the time where they needed more help.
We had been in discussions with Kevork for probably a couple of weeks about potentially making a significant contribution. It was either going to be to Jersey Shore University Medical Center or the Hovnanian Children's Hospital. And one of the areas that we went to was our neonatal intensive care unit. And I'll never forget this. There we were, next to a bassinet with a 1-pound baby that the nurse was showing Kevork. I have to tell you, we were all so emotionally moved, and I even saw a little tear on the side of his eye.
And that's when we decided to come to Jersey Shore, because we knew, God forbid anything was wrong with the baby, at least they had the NICU here and we were prepared and ready.
Well, the way they were explaining it, and our platelets were so low, they didn't know that once they cut it, they didn't know if they'd be able to stop the bleeding. And I didn't know if I'd have to go home to my kids and explain that Mommy and their sister weren't coming home.
And Lisa, she was the primary nurse for Raven. I remember being very scared and nervous because we didn't know what the outcome was going to be of me or Raven. And she came over and wiped my tears, even though she didn't have to, and told me everything was going to be okay and that they were going to do everything in their power to save my baby.
I'd say the first time I saw Raven, I didn't believe or think that something so small could last.
Without the donations, I don't think the babies would be able to survive.
Actually, it's amazing how the community pitches in. It's unbelievable. We had so many fundraising events already, and there's so much donations coming, being poured out from the community. That's the only reason we can afford this, because this is too fancy. It's a futuristic setup with, look at just one Omni bed is $50,000 a piece, and we are getting 13 of them.
Because of Kevork and Emily's wonderful gift, we've been able to bring unprecedented care to this region in terms of a vast array of pediatric services. And you can see it every day in our pediatric units, the benefits that are given back to the community.
I do remember the day Kevork came home and he was all excited and had big smiles, and it was surprised that he donated for Children's Hospital. So I saw how happy and excited he was, and so was I. And I think it was a very great deed that he did, and it benefits not just our children and grandchildren, but the whole community and all the neighborhood all around us. And we have had very difficult days and good days, but thank God that everything worked out and we were fortunate and we can do something to help others. Thank you.
I will stand here on behalf of my colleagues and thank Hovnanian family, especially the matriarch of the family, Emily.
Thank you.
Thank you so much, Mrs. Hovnanian.
Thank you. Thank you, Emily, so much for all of your help keeping kids healthy and making sure that they enjoy their time while they're here with us in the hospital.
Of course, I would want to thank them for everything they do. We wouldn't be able to do this without them.
It has been an amazing journey where we will continue to serve our community's children and families as our own. Thank you from the bottom of my heart.
Mom, love you, miss you. Sorry I'm not here tonight to honor you, but I'm just as proud as I could be.
Hi, BB. Congratulations.
Congratulations, BB. We love you.
Congratulations, BB. We love you.
Love you, BB.
Love you, BB.
Hey, BB. I love you, and I just wanted to say congratulations.
Thank you to all our donors who are here tonight. Because of your generosity, we've been able to develop programs, services, and facilities that are second to none. We thank you from the bottom of our heart.